We live in an age where innovation is not something that one company does alone at home, but rather something that requires a whole coalition and the flexibility, the mental flexibility to accept others and to have a transparent, honest dialogue. And that's exactly what we're doing. America grew not because of American will. It grew because we listen to the ecosystem, whether it's providers, payers, consumer innovators, and others, and allow them to develop around the platform that we have created. Well, absolutely. I mean, essentially, we're in healthcare. So knowing more about what happened, basically being connected to people almost continuously, being able to truly analyze and understand this data and making actionable to providers and payers so they can turn back and create the most effective intervention back with the consumer is at the heart of the new model of care that is almost entirely data-driven without compromising the very important human relationship between me and my trusted provider. Some of the unmet need that we are focused on is not limited to the United States. In fact, everybody around the world is struggling with access, with the cost of care, with the fact that care is not democratic. If you're lucky enough to live in Lausanne and access the Shuv, or in Geneva, you have a wonderful canton hospital there. But many people live elsewhere, and even in those cities, it takes too long and costs too much to see a doctor. So we are reaching out to people truly around the globe to help us realize this new model of care so we can improve outcome truly on a global basis. It took many years for people to realize that what's happening is huge. And I think everybody did. But in order to make a difference, it's not enough to have one segment or one company. It's not enough for a doctor to say, I'm going to change my ways and be available to my patient anywhere, anytime outside the room. You need people to pay for this visit. You need to make consumer aware of this visit. You need to make sure that the therapies are available anywhere in my local pharmacy and things of that nature. It takes a village. What's truly exciting is that you see people from various companies in and outside healthcare, from governments to pharma, to PBMs, to different types of payers and things of that nature, that are all aligned in order to truly recreate and remodel the way that people get care. And the end result is unbelievably impactful because we are going to democratize healthcare. We are going to make it high quality, available anywhere across really the entire ecosystem.